If you're troubled by aches and pains and can't find relief, Prolotherapy may be the remedy you've been looking for. Kristie Bair and Dr. Bair of Bair Medical Spa join us today with the details. Good morning to both of you.
Good morning.
Good morning.
Looking fabulous, of course. And I hadn't heard of Prolotherapy until I started looking everything up for the segment. Is this a new treatment?
No.
Not really.
Okay.
No, it's been around for a long, long time.
Okay.
Maybe back to the Greeks, but certainly since the 1930s, 1950s, it really started to become widespread treatment. So, and it has gradually gained traction and becoming more and more popular and known.
Tell us what it is. What is it all about?
It is the healing of stretched and partially torn ligaments and tendons. Non-surgically,
Yes,
which is
our favorite part of all of it. Yeah.
Those sorts of structures do not heal well because they don't have a good blood supply.
Okay.
So this involves injections of sugar water.
Really?
Basically, yes.
Really?
Sugar will irritate those structures, irritate the ligaments and tendons, and cause the body to start healing them naturally.
Wow.
To regrow tissue. I explain it to people, you know, when you get a cut on your hand, those cells replicate themselves to heal that cut. That's exactly what they're doing. They're irritating that ligament, and in an effort to heal itself, it regrows cells.
And it makes you not only looks better, but it feels better, and that's really the key.
Well, this kind of goes back to my roots as far as anti-aging. You know, I started in family practice. I was doing a lot of sports medicine, and this was kind of the basis of, you know, my getting into rejuvenation.
Really?
Yes.
But tell the 21 years ago he was cliff diving at Elephant Butte with our boys and broke his back. And,
Dr. Bair! Oh my gosh!
And,
you did?
Yes.
So he got real serious about looking into prolotherapy then, and flew to Arizona and was treated by a doctor several times there.
So a personal experience really inspired you to look into this.
Oh, I've been treated basically from base of my skull to my toes.
Wow, so you really come from a place of knowing exactly what you're doing here.
I am just always beating myself up.
Oh my gosh, don't do that.
So he became certified and is continually taking courses in it.
Well, thanks for sharing that, because I think it really, and you know, when people come to you with these problems and they know you've been through something yourself, it does give you a different sense of understanding and trust. It really does, and it makes somebody feel more comforted, I think, personally. And so what kind of ailments specifically can be helped with prolotherapy?
Aches or sprains and strains particularly.
Okay.
You know, low back pain, degenerative disc.
Okay.
Kristie had a ski accident.
The two of you, I'm keeping you both.
Yeah.
Had a bad neck injury.
Oh gosh.
Eventually, you know, she tried physical therapy, she tried exercise, rest, and all that, and did physical therapy, stabilized it, and you know, she's pain-free.
Wow.
And that's kind of a typical scenario.
Big deal.
Knee injuries, ankle injuries, wrist injuries.
Okay, so it pretty much covers
any
the gamut.
joint.
And so who would be the ideal candidate for this treatment?
Really, anyone.
Anyone? There's no age limit? Or?
No, there's no age limit. If it's a completely torn ligament, completely torn tendon, this is not going to work.
Okay.
So I need some X-ray, MRI usually in order to be able to know what I'm dealing with. But in those selected folks that have those sorts of injuries, get about an 80% cure rate, if you will.
Really? So it's very successful.
Yes.
Now, as far as getting those x-rays, or do they have to bring that to you, or do you guys do that?
I can order them,
Okay.
but if they can come to me with those results, that, you know, makes the process quicker.
And speaking of the process, how many treatments are required to really make a difference?
It varies.
Okay.
Yeah, that's a good question. Typically, it's a minimum of about 3.
Okay.
It only took 1 on my neck.
Really?
Yeah. So, and I put it off for a long time because I kept thinking I could heal this myself.
Don't we all?
Honestly, it's uncomfortable. You know, you're getting injections.
Sure.
The sugar water is mixed with a local anesthetic, so that does help. But you know, this is
it's not
injections.
A massage.
Right.
Yes,
It's already injured tissue, and now you're injecting it to irritate it. So yeah, it's an uncomfortable procedure.
But not painful? Just
no, and it's not uncomfortable immediately afterwards.
Okay.
Once it's over, then it's over, and that anesthetic is also in there.
Sure,
So.
and for the pain that you're probably going through leading up to the time you get the treatment, it's obviously worth a few injections and maybe a little discomfort to know in the future you'll be back to normal
That's
again.
exactly where you get. That's where I got with my neck. After I put up with it for a couple months, it was like, okay, enough. This is worth a 30-minute treatment.
Well, would you have to go back and do another treatment again, or once you've done this, is it done?
Usually you get healing and increase in strength in those ligaments. It stabilizes. So it's usually you go through the series of treatments and you're done. Unless you're like me and keep on injuring yourself.
Yeah, if you keep on injuring yourself, then you have to go back again. It makes sense. Now, where can our viewers go for more information?
They can call 881-1532 or go to our website, bairmedicalspa.com, and there's an excellent page there that explains prolotherapy.
Fantastic. Well, thank you for sharing your stories. Please be safe, the two of you. We need you. Thanks for being here. And coming up after the break, a new way to dine at Sandia Resort and Casino. Don't go away.